This is Gregg Patterson with Arkansas Farm Bureau, and on this edition of Arkansas AgCast, we're talking with Dr. Chelsea Bland Smith. She's a veterinarian with the Broken L Mobile Vet Clinic out of Western Arkansas, and she also works in Oklahoma and Texas. And Chelsea, welcome.
Hi, how are you?
I'm doing great.
Thanks for the opportunity to talk about vesicular stomatitis.
Hey, no problem at all. And tell us, what is it? Because we've had an outbreak here in Arkansas recently. In 8 counties, there's some, restrictions on travel and whatnot. What is this disease or virus?
So it's a virus, and it's spread by vectors such as biting flies like the black flies and midges or chelocoides. And it has a life cycle. You don't see it every year in the U.S. You see it pretty frequently in Mexico, and it typically tends to travel up the Rio Grande River, so you can kind of see it more in the western portion of the United States. But it's something that kind of waxes and wanes. Usually the greatest control that we have is when we go in to have our first frost. And we get rid of our flying vectors. Other vectors can be horses sharing stalls or buckets, so direct and indirect contact as well.
What do livestock owners, and talk about the livestock that get this particular virus, what do livestock owners need to pay attention to and look for?
So any animal that is hooved, so that includes horses, cattle, llamas, pigs, goats, sheep, anything that has a hoof is susceptible to vesicular stomatitis. The majority of outbreaks that we have seen have been in horses. The type of lesions that you'll see will be blisters around non-haired areas or thinly haired areas, such as the mouth and muzzle. You can see it almost looks like best relation I can come up with would be like canker sores in people, where you get sores in your mouth. The vesicular stomatitis is very similar to that. So you can see lesions around their mouth. Very rarely do you see it on their ears, but you can. Around the coronary bands on their hooves is less common, but it's possible. And then also around udders or sheaths.
So horses seem to be the main hoofed animal right now that's having an issue with this, but it can also affect cattle, correct?
Correct.
This may be an off-the-wall question, but can humans get this disease
Absolutely.
Or this virus as well?
It's not common, but it can occur. So making sure that when you're around animals, and this is just a good thing in general, as far as biosecurity and hygiene, that you're washing your hands between animals. If you happen to have a animal that has VS, that you change clothes between animals before touching them, because you can transmit it from your clothes, shoes, all of that kind of stuff. It can be transmitted through buckets. So those are all indirect vectors or causes. And it can also be caused with direct contact. So like horses touching noses or something like that, in addition to the flying vectors.
How about, is there a vaccine for this?
Unfortunately, there's not. And part of the reason behind that is that vaccine development is extremely expensive. So for something that doesn't have a normal cycle in the United States, it's really hard for the drug companies to justify the cost in developing a vaccine.
What things should people do if, all of a sudden their animal, they really suspect it has it? Obviously call the vet and quarantine that animal. What are some of the things that you as a veterinarian can do for that animal? Does this result in death in the animals, or can they come through this okay?
So one of your biggest aspects with it is supportive care. Some animals are so painful that they won't eat and drink properly. So you may have to do some IV fluids or do a tube into the stomach, a nasogastric tube or orogastric tube, depending on your species, and potentially put food stuff and water in there to keep them going. And that depends on the severity of the situation. It also depends, pain control is also something that is really important, but if the animal is dehydrated, then that can cause secondary issues. So working with your veterinarian to determine what the best course of action is for your individual animal is really important. Very rarely is VS fatal. It usually will run its course anywhere from 1 to 2 weeks, and then they'll be over it, but the supportive care is the important aspect of it.
Well, just for folks' information, the counties that are in Arkansas, and I'm going to read from a list here that currently have movement restrictions, are Baxter, Benton, Fulton, Carroll, Marion, Madison, Crawford, and Washington counties. And then one county up in Missouri, Ozark County, also, it's been found up there, and Adair County in Oklahoma. We've been talking with Dr. Chelsea Bland Smith with Broken L Mobile Vet Clinic. And Dr. Smith, if somebody, like I say, you practice all over the place. If somebody needs to contact a vet, go ahead and give your number.
My number is 870-557-8404. You can also find me on Facebook at Broken L Vets, and I post a lot of different pictures and cases that I do throughout the week. So if I end up with a case, then I'll end up posting it, but I'll also follow up with this interview and post some additional information and links.
And you are truly a road warrior when it comes to traveling and getting around. Folks can also go to the Arkansas Department of Agriculture website, which is www.agriculture.arkansas.gov. Dr. Bland Smith, thank you so much. She's been telling us about Vesicular Stomatitis Virus, VSV as it's known. And there has been an outbreak here in Arkansas. And thank you so much for spending time with Arkansas AgCast. We appreciate it.
Well, thank you for the opportunity to provide that education. And if you have questions, feel free to contact me or your local veterinarian.